All right. Hello, everyone. Welcome back to Pep Talk. So, why do so many people wake up one day and suddenly feel off? You're exhausted, even after sleeping, your motivation disappears, your body composition changes, even though your habits didn't change. Your anxiety spikes, your libido crashes, your workouts stop working, and nobody seems to be connecting the dots. For women, it may be perimenopause or menopause. For men, it may be declining testosterone, stress hormones, poor sleep, inflammation, or metabolic dysfunction. And here's the important part: hormones do not work alone, they're an orchestra. When one section's out of tune, estrogen, progesterone, testosterone, cortisol, insulin, thyroid, growth hormone, the entire system feels off. So today, we're diving into how hormones interact with each other and with how peptides can support optimization. So, how restoring balance can actually help people feel stronger, clearer, leaner, healthier, and more like themselves again. So, again, welcome to Pep Talk by Driven Healthcare. I'm Dr. Carrie Moore, and this is a podcast where we break down peptides, wellness, performance, recovery, longevity in a way that I hope actually makes sense for you and for our patients. Um, so, let's dive into it. And if you have any questions like along the way, just please feel free to drop it in the comments. I should get them if you're watching live. And if you're not able to watch this live and you come on later, then go ahead and drop me a message on Facebook or Instagram and let me know what questions you may have or other topics you may want me to cover. So let's dive into it. I'm trying to see here. Okay, so yeah, I should be able to see if you hop on board. So let's get on into it. So one of the biggest mistakes I think I see in wellness and medicine is actually people that focus too much in one hormone in isolation, right? You see people that they're talking only about testosterone. Somebody says my testosterone's low or my estrogen's low or my thyroid is off. But see, the thing is, like, your hormones are communicating constantly. We are, think about them, our hormones, as being text messages going back and forth between organs. Okay. Think about them as constantly communicating back and forth. And so the brain talks to your thyroid. The thyroid affects metabolism. Your insulin affects fat storage and inflammation. Cortisol affects your sleep, weight gain, and testosterone. So estrogen affects your brain, your bones, your skin, your cardiovascular system, where progesterone affects sleep and anxiety, and testosterone affects energy and muscle, confidence, libido, and cognition. So if one hormone gets disrupted, the other ones tend to follow along. Not always, but they tend to. This is why people can feel terrible when one value is technically normal and another one's low. So, let's think about it in terms of how it impacts you. So I want to dive first into, let's talk about the women, because perimenopause is probably one of the most underdiagnosed and misunderstood transitions in medicine. Really has not gotten the focus it should. People have just, I think women have just maybe learned to deal with it. And it can actually start years before menopause. And let me say, if you're like in that zone, you're like me, you're in your 40s, your 50s, you're starting to feel that just not quite right. That's probably what's going on with you. And it's time to start taking a look into it. You don't have to feel terrible. I think as women, sometimes we get this feeling of we should just cope with it. We're the caretakers, we are having to deal with our kids, with our spouse, with our job. And the last thing we're starting to think about is, why am I feeling so miserable? I don't feel like I did back in my 20s and 30s. And so what's going on with me? And that's why I really think it's important that you understand how these hormones work together and what you can do to make yourself feel better, because you do not need to feel terrible all the time. You just don't. So the the symptoms of perimenopause are actually pretty broad. So, fatigue, brain fog, anxiety, irritability, poor sleep, weight gain, loss of muscle. And, a lot of people, talk about, they get palpitations at night, they're waking up sweating, they're not sleeping as well. They just feel awful. They just don't feel good. So, and then obviously the hot flashes are the thing that we think about the most. I think that it's one of those things in menopause everybody talks about. And sorry, my thing is dropping on me here. But palpitations again, anxiety, worsening migraines, joint pain, decreased motivation, just not feeling like you want to get up and do stuff. And what many women don't realize is that estrogen and progesterone fluctuations affect nearly every organ system, like all of them. So estrogen supports your brain function, your skin elasticity. If you're noticing like your skin's like getting drier, it's not the skin you used to have. It affects your cardiovascular health, your bone density, insulin sensitivity, and vaginal and urinary health, vaginal dryness and things like that when things start to be off. Progesterone often has a calming effect and actually can help support sleep quality. So when that's low, you're not sleeping that great. So when these hormones fluctuate or decline, women can actually feel emotionally and physically different, just like overnight. It's not necessarily like it can literally be you're feeling great one day and then the next day you're like, whoa, something hit. And usually starting around the 40s to the 50s, but it can happen earlier. Some women experience a early onset menopause or perimenopause symptoms. So, but here's something important. It's not just about replacing your hormones. It's not what's about. It's about restoring the balance between your hormones within your system. So too much estrogen without adequate progesterone might actually worsen your symptoms. So for some women, at least. So I see sometimes women who are put on one regimen versus another, and they don't have both, and they really end up having maybe worsening problems, even like more regular bleeding and things like that. So poor sleep, for example, if you don't have enough progesterone, can worsen your cortisol, and the elevated cortisol worsens your insulin resistance. So we think about insulin resistance is worsens weight gain and inflammation. So that's kind of this interesting dynamic between our hormones and our internal peptides, if you will. Because remember, insulin is a peptide. It's one of our natural ones. And a lot of these peptides that we talk about are naturally occurring substances in our body. And so, your inflammation with that insulin resistance and weight gain can happen. And that can be totally tied to the fact that your progesterone, all your hormones are just off. So everything's connected, right? So, yeah, I had this cute, I don't know if you can see it, but where'd it go? So it says, I start my day, each day as Mary Poppins and end it as Cruella de Vil. Such a, good representation of what perimenopause and menopause can feel like with the fluctuation of hormones for sure. So let's talk about men for a second. And actually, I will tell you, many of my patients, like actually I'd say more patients than not, that come to me for their hormones who are like, I am not dealing with this, are the men. And so where women were like, oh, we'll just deal with it, we'll cope with it. Men tend to come to me a little bit more and say, something's off, I don't feel good, my libido's down, and they're just, more, I think, apt to show up at clinic and say, I need something done because this is not working for me. So remember that, women, like, you too can feel good. You don't have to suffer. I think, there has been a lot of changes in what has been FDA approved and recommended here recently. So, a focus on women's health is coming, and I think it's going to be much more in the forefront for medicine, which is great. But let's talk about you guys. So men, so you often assume that low testosterone only means low libido, right? But testosterone actually affects way more than that. So when you think about low testosterone, it may contribute to fatigue, loss of drive, increased body fat, reduced muscle mass, brain fog, poor recovery, depressed mood, decreased confidence, and sleep issues. And here's what's happening today. Modern life is basically designed to suppress male hormones. Poor sleep, stress, ultra-processed foods, alcohol, obesity, sedentary lifestyles, chronic inflammation, all of these things can affect your internal testosterone production. And, testosterone doesn't operate independently either. So if a man has, let's say, elevated cortisol level from chronic stress, so like stress, poor sleep and sleep apnea concerns, insulin resistance, or inflammation in general, testosterone optimization may not fully work until the entire system improves. So that's why comprehensive hormone care matters. So, I'm not saying that we give men the progesterone and estrogen and things like that. In fact, it's just important to, when you're monitoring testosterone, to think about in conjunction with things like your cortisol levels, your IGF levels, which is insulin growth factor, and your insulin resistance, and see, how those things are tying together. But I do feel that men do tend to show up a little bit more and ask the questions and be ready to go to fix it, because one of the things they do recognize that's important to them is their libido and also their confidence. So, and I'll tell you, I'm happy to see men, women, doesn't matter. Tons of male clients that come in that I really feel like they feel so much better when they have their hormones optimized. So let's talk about the peptides and how those fit in, right? So the peptides are actually signaling molecules, and we've talked about this before. They're essentially chains of amino acids that help tell the body what to do. Now, they're not magic, and they're not a replacement for sleep, nutrition, movement, or your hormones. So peptides, not a replacement, but they're an adjunct. So, but in the right patient, peptides may complement optimization strategies where you've got your hormones optimized and you add those in. So some peptides focus on recovery and tissue repair. Some support growth hormone pathways. Some target body composition. And some may actually support inflammation or mitochondrial function. We've talked a little bit about those in the last previous weeks. For example, the growth hormone secretagogues, like ipamorelin, tesamorelin, samorelin, those certain peptides stimulate natural growth hormone release patterns. And growth hormone itself affects recovery, your muscle maintenance, sleep quality, body composition, and collagen support. Then we talked recently about MOTS-c and explored that, and that has been it's funny, I had that cartoon up there for a long time. MOTS-c's been explored for metabolic function and mitochondrial health. AOD 9604, often discussed for fat metabolism support. In BPC 157 and TB 500, these are commonly discussed for regenerative and recovery spaces for tissue healing. And then there's also the coenzymes with like NAD related therapies. So these focus on cellular energy and mitochondrial support. But here's the key. So peptides work best when the foundation is optimized. You're not going to have your peptides working fantastically if your hormones are off. So if someone is severely sleep deprived, inflamed, insulin resistant, sedentary, stressed, nutrient deficient, no peptide is magically going to fix that. So when you think about the hormone stack and how everything interacts, I think that's where it really gets interesting. And so when hormones improve, people often say, I feel alive again. I feel great. I am feeling back to myself. So why is that? It's because these systems overlap. And, um, when better sleep improves your cortisol level, improves cortisol, improves your testosterone, may improves your muscle mass, and more muscle improves insulin sensitivity. So that's why strength training, very important. Improved insulin sensitivity improves your inflammation and your energy. In women, optimize estrogen and progesterone, improve your sleep and mood. Again, better sleep lowers your cortisol level. And lower cortisol levels will likely to improve your weight management and decrease your anxiety. So then after that, the peptides may support recovery, body composition, or performance on top of that foundation. And this is why wellness medicine should never be cookie cutter, ever, ever. The goal is not to turn everyone into a bodybuilder or a biohacker. I honestly hate that term, by the way, but you can be a biohacker if you want. It's fine. The goal is to help people feel mentally sharp, sleep better, maintain your muscle, support long-term quality of life, and feel confident and functional again. So let's talk a little bit about that. With that, we need to have some realistic expectations. And we also need to be honest about it. More is not always better. So you don't need necessarily to be if you're not needing certain things, you don't need to stack all these things on top of each other if you don't need them. One important thing with testosterone, for example, in younger men, some people they're in their younger ages, in their 20s, and they tend to have good testosterone levels, right? And they still went, I need to be on testosterone, but actually can impact your fertility. So hormones in general are not cannot be everybody one size fits all, and neither can the peptides. And this whole plan needs to be personalized for you as an individual. I think that's very important. So your hormones need to be carefully monitored. Your lab work matters a lot. Symptoms matter, and your medical history really matters. So, but more is not always better, right? And not every patient is a candidate for every therapy. And that's a very important thing. We talk about safety. We talk about on this podcast using a physician oversight to do your peptides. I know that you can get them online. I know all the friends, and we get on Reddit and people are saying, do this and do this. But it's very important because some peptides may actually increase your risk of, especially if you have active cancer, could throw that all off. You may not, and that goes for hormones as well. You need to be very cautious about whether or not you are a candidate. So that's why that lab studies really, really are important, right? We in males will monitor your PSA, your prostate specific antigen, to ensure that we're not looking at a problem with your prostate or potential prostate cancers. Always with our women that are on hormone therapy, to suggest that they have their annual mammograms, make sure they are checking for those, because as you may know, many breast cancers are hormone receptor positive. And so you definitely don't want to be throwing a bunch of hormones at something that's going to help it grow. And that also goes for some of the peptides. When we talk about growth hormone, right? Growth hormone is something that promotes growth. And so it may increase growth of other things that we don't want. So it's very important that your cancer screenings and those, when you're thinking about optimizing your health, also think about preventative in ensuring that you are a good candidate for that therapy. So I would also say there is a huge difference between evidence-based hormone optimization and unsafe internet bro science. Be very careful taking your advice from influencers who are not doctors, who don't know a thing about what hormone impacts that. They don't even know where the pituitary gland exists in your body, if it's up in your brain. So be very careful with that. So the best outcomes you're going to have happen with individualized treatments and proper monitoring, realistic expectations, right? Again, we're not trying to take everybody and turn them into a bodybuilder, but we are trying to make everybody feel like they could be, right? Um, Nutrition, huge. Nutrition is a big component of this, ensuring, staying away from the ultra processed foods, and living clean dietary components actually will help optimize these as well. Sleep optimization and stress management. I am an emergency room doctor, and I have a lot of ER doctors who ask me some questions about things like this with the hormones and whatnot, as well as peptides. And we live a pretty stressful and poor sleep life. And so that's why, not everything's right for everybody. But I will say, if you are living as high stress, you're tired a lot, you need a little bit more energy, there is some pretty decent data on the NAD therapies, and using NAD supplementation. It gets, into that mitochondrial energy production and ADP and all that. And so definitely worth looking at, I think. And I probably get asked the most about NAD therapy. And again, it's not a peptide. It's a coenzyme that naturally exists in our bodies, but sometimes that can really be helpful for people to add that in on top of making sure your hormones are all, in line. So that's one of the first things we do when we are doing testing for a new patient. We are looking at your hormones, and we say you need to do lab work before you start peptides and before you start hormones, is because we need to know what we're dealing with. We need to know what your baseline is. So we are checking your cortisol levels, your IGF, your insulin levels, and your A1Cs, your liver function, your kidney function, your estrogen, testosterone, progesterone, all these things, and thyroid, big thing to monitor. If your thyroid is off, man, everything else is going to be off. That thyroid is, I think of it as one of the big conductors of things. Of like, if it ain't happy, you ain't happy. So that's kind of what we do in order to prep and make sure everybody's individualized in their plans. So, as we roll out of this today, if you're feeling exhausted and foggy, inflamed, unmotivated, you're not crazy. You are definitely not crazy. Especially women, you're not crazy, and you're not crazy to seek out care with a physician and say, hey, I don't feel great. And you're good to come in and say, I don't feel like myself. Let's look into this and see how I can optimize my wellness, because you don't have to feel terrible. And you're not alone. And I want you to know that you're not alone in how you feel. So many women and so many men who have imbalance of their hormones are seeking care and seeking a solution to feel better on a daily basis. So when you start addressing the system as a whole, hormones, sleep, metabolism, recovery, stress, and nutrition and performance, that's often when people are finally feeling better again. So thank you very much for joining me today on Pep Talk on Driven Healthcare. If you enjoyed this episode, please share it with someone who's been saying, I don't feel like myself anymore. We will be back here soon, and with some awesome news. We will be having a new app that should be going live here shortly in the next week or two, called My Pep Doc. And you will be able to communicate with your physician through it if they are part of the users that use this app. Uses a lot of AI and things like that to help get the best evidence for peptide use, metabolism, nutrition. We have some shopping lists and things like that, dietary components, as well as the hormone optimization and peptide dosing. So be on the lookout for that. Again, if you enjoyed this and you found this to be educational, please share it with somebody who feels like they don't feel like themselves anymore. And we'll see you next time on Pep Doc.